A very good morning and a warm welcome to all our esteemed guests and to dear learners. I am Dr. Riya Tukrar from the Homeopathic Academy, and we are here today to discuss a very interesting topic, immunity and homeopathy with Dr. Harsh Nigam. Today we are going to learn a lot about immunity and especially in the current pandemic scenario. We have Dr. Harsh Nigam to teach us just that live with us right now. But before we go ahead with this webinar, most of you already know about the Homeopathic Academy, but for those who don't, let me quickly introduce ourselves. So, the Homeopathic Academy, or THA as we call it, is Bijan RX's efforts towards digitalizing homeopathy and providing a platform for quality education online. THA offers you a range of online courses by well-known academicians on numerous subjects of homeopathy at undergraduate, postgraduate, UPSC and CME levels. All these courses are enriched with state-of-the-art audio-video technology, text and vector animations, giving you an HD quality audio and video experience made by a dynamic team of qualified doctors, video editors, and many more professionals. These courses will perfectly complement your studies to make learning an extraordinary experience. On your screens, you can see some of our courses currently streaming on our website, www.thehomeopathicacademy.com. You can also see the course on Modus Foundation and Modus Prescriber by Dr. Harsh Nigam. Here, Dr. Harsh Nigam will teach us how to adapt concepts of organon in modern clinical scenario and improve our clinical practice, which is an essential need for all us modern homeopaths. So these are some of our upcoming and new courses as well. We have just launched a course by Dr. Frederick Stroyens. You can visit our website to see our courses. Quickly going through it so that we can start our learning. This is the course by Dr. Harsh Nigam on Modus Foundation and Modus Prescriber. You can purchase it as a combined course or as a separate courses on Modus Foundation and a separate course on Modus Prescriber as well. So that's it about us. Thank you for listening. Coming back to this webinar, can we please have you here with us, Dr. Harsh Nigam?
So here I am.
Thank you for being here.
So let's start with the course.
So let me introduce you to all. What if some people are new today?
Okay.
Let me quickly introduce you. So everyone, Dr. Harsh Nigam, who we have as our respective speaker for today. So he is a renowned practitioner and an author of 8 books on homeopathy and 12 research papers published in various Indian journals. He has obtained an MBBS and MD in physiology, but he could not suppress the heritage of homeopathy that he received from his father, Dr. Jagdish Chandra Nigam. He has obtained his membership of faculty from Royal London Homeopathic Hospital, UK. He's currently spearheading a multi-speciality OPD hospital at Kanpur, a center of excellence in modern homeopathy. He's well known for providing research-based medical solutions to various health issues. He aims to establish homeopathy on its scientific merit and make it integrated with orthodox medicine in such a way that the scope and limitations of homeopathy are well defined. About his publications, he has two of many internationally recognized books, and you can see them on your screens. Principles and Practice of Homeopathy Case Management and Miasma, The Road Less Traveled. Both of them are available with Bijan Publishers on our website. So that's about our speaker for today. Thank you so much, sir, for being here with us again. And let me quickly explain our learners how this interface works. So on the right-hand side panel of your screens, you have a short chat box. You may type your question or whatever message you have for Dr. Nigam right there and press the button next to it to send it to us. I request you all to send your questions only after Dr. Nigam's lecture is over, as that might disturb him and we wouldn't want that. Without wasting any more time, over to you, sir. Let's start learning.
So, good morning, everybody. Last webinar was a little boring. In fact, there was a comment that came that is it a research paper? Yes, it was kind of a research paper, so that you must know where this theory of miasma is coming from. Actually, there is a famous saying that ontology repeats philology, which means that the embryo must go through the whole cycle of humanity. I mean, that has to be done before you understand the human form. So it was a boring lecture, but I promise you today won't be that boring. In fact, it is going to be very interesting and clinically very gratifying, because today we are going to talk about COVID also, which is a very important discussion, and nobody is talking about it because most of the people are, especially the government and semi-government bodies are especially worried about the legal hassles. But we are going to talk about it today. So let us start with today's presentation, and that is immunity and homeopathy, which would lead to certain keywords which are very important in today's clinical scenario of COVID. So let us start again from the beginning. Now, vital force, which was envisaged by Hahnemann, was not coined as vital force by Hahnemann. It was coined as vision in German by Hahnemann, and vital force was a name given by Dagen while he was translating the Organon 5th edition. Now, Hahnemann knew English, but he never wrote Organon in English. He wrote it in German because he was a proud German. Number one. Number two, vision does not have an equivalent substitute word in English. It has a substitute word in Sanskrit, which is called as pranas. And Hahnemann also coined several words for vision all through his organon, and they were spirit, spiritual, spirit-like, dynamic, dynamis, and autocracy. Now be very clear in mind that Hahnemann uses these terms to explain to us the comparison between the grossness of the material world to the intangible, invisible material world. So he is trying to shift our mind from the grossness of the material world, like this is the gross material clip, to the intangible, unseen world. That is a quantum world. Now in aphorism 10, he says the material organism, that is our body, without the vital force is capable of no sensation, no self-preservation. It derives all sensation and performs all the functions of life solely by means of immaterial, which means dynamic, unseen, untouched vision. The life principle, the vital force, which animates the material organism in health and in disease. You can compare this to a light bulb. Now, light bulb without electricity is a dead thing. It doesn't glow. But once the invisible electric current passes through a light bulb, it glows. So our body is dead like a light bulb without electricity, and it is alive like a glowing light bulb when invisible electricity passes through it. In aphorism 9, Hahnemann states in the healthy condition of man, the spiritual vital force. Now, while Dagen was translating the organon from German to English, he wrote spiritual vital force. It should have been spirit-like vital force. Now I repeat again in a corrected form. In the healthy condition of man, the spirit-like vital force, in bracket Hahnemann writes, autocracy, the dynamism that animates the material body, rules with unbounded sway and retains all the parts of organism in admirable, harmonious, vital operations as regards both sensation and functions. Now, this is a beautiful concept of homeostasis given by Hahnemann in aphorism 9 about 50 years before Claude Bernard coined the term homeostasis. So Hahnemann was ahead of his time. Now, why vital force should maintain the body in homeostasis? Hahnemann gives the answer in the same aphorism, and it is so that our indwelling, reason gifted mind can freely employ this living, healthy instrument for higher purpose of our existence. Now, this is very important. You must understand then that in Hahnemannian physiology, Hahnemann has divided the immaterial into two: the outer sheath of vital force and the indwelling, the inner sheath of unseen dynamic as mind. And the purpose of the mind is to think, to reason out, and freely employ this healthy body for the higher purpose of our existence. Like we are doctors, we are homeopathic doctors. The higher purpose of our existence is healing, and we can only work to the best of our capabilities when our body is functioning in homeostasis, in balance. So that is how Hahnemann defines health in aphorism 9. Now Hahnemann, in his Hahnemann physiology, thus creates a concept that there is a material body, the outer physical sheath. Then there is an innermost mind, and there is an intermediary vivifying vital force. This is what Hahnemannian physiology tells us, which is a beautiful concept, way ahead of its time. Now, in the introduction to the organon, Hahnemann says that the proper function of this instinctive, irrational, and unintelligent but automatic vital force is the maintenance of the life and health of the organism. Beautiful. Hahnemann is telling you that vital force is only made to maintain the body in homeostasis. So beautiful and so perfect in conceptualization. Hahnemann also then tells you the attributes of vital force. The vital force, which of itself can only act according to the physical constitution of our organism and is not, mind it, it is not guided by reason. It has no reasoning power of its own. It has no power of knowledge. It has no power of reflection and no power of judgment. These are the attributes of mind, but not of vital force. The vital force by itself cannot restore the organism to health. It was not given to man to be regarded as the best possible curative agent to restore deviation of health to the normal condition. And at this point, Hahnemann deviates from what Paracelsus has said. People say that Hahnemann copied Paracelsus. It is wrong. Hahnemann was in the curative aspect, in the management aspect of disease. Hahnemann said that Paracelsus is wrong in saying that a doctor must be a servant to nature. Paracelsus said that diarrhea is body's natural reaction to a disease, and one must imitate diarrhea, which means if somebody is having diarrhea, you create more diarrhea so that the patient is cured of the disease. Hahnemann said no. Diarrhea is an automatic response of the vital force against the invading agent, and the vital force is automatically trying to get rid. But if you start imitating it, the vital force is going to be weakened and the body is going to be weakened. Vital force cannot cure. This is something that you must remember. So the attributes to the vital force are, and in the bracket I have given you the references where you find them in Organon and in the second edition of the Materia Medica Pura. Also in a small paper written in 1813, which you find in the lesser writing of Hahnemann, it is called as the Spirit of the Homeopathic Medical Doctrine. So the attributes of vital force are, number one, it is non-material, which is it cannot be seen by five senses. It cannot be seen, it cannot be touched, etc., etc. It is invisible. It is indirectly discernible, which means you can only assess it by your mind or through the symptoms that the deranged vital force is going to project. It is instinctive, which means it has a reflex automatic response. It is irrational. There is no reason. It is unintelligent. It is automatic. It is not regulated by physical and inorganic laws. Now remember, quantum mechanics has come in the 19th century. Now Hahnemann in his time, 200 years ago, is talking that it is these forces, the vital force, the force of the mind, and these electromagnetic forces are not regulated by physical or inorganic laws. How far advanced he was from his time. Now the last step before jumping into the dynamic pool of existence. I am coming back to aphorism 9. In health, the spirit-like vital force, in bracket I have highlighted autocracy because this is important. The dynamism that animates the material body rules and retains all parts of the body in harmonious vital functions and sensations. The vital force is the intermediate agent between the mind and the body, enabling the mind to control the material body, and number two function is to maintain the body in homeostasis. It would be unwise to suppose that this vital force is an organized entity or a thing or an object. So you must at this point be very clear that vital force is not a thing. It is not a ghost inside a machine. You can't see it. So it is not an organized entity. It is a concept. For example, Hahnemann categorically states in footnote aphorism 11 that vital force is a conceptual controlling principle of life. Let me tell you about something about Hahnemann and his working of his mind. Hahnemann knew that he is talking far ahead of his time. So what he did was, all the concepts, all the visions of future, he hid them in the footnotes of his organon. So his footnotes are very important. Even his appendix of the organon is very important. You must read them very carefully. And in footnote of aphorism 11, he states very categorically that vital force is a conceptual controlling principle. It is a concept and not a thing. Like, for example, in modern day physiology, cardiac axis is not a thing, it is a concept. It is a sum total of all the action potentials in all the fibers of the heart. And it is represented by a vector. And it is upon the cardiac axis that the whole of the ECG is based and the interpretation of the ECG is based. Similarly, vital force is a concept and can be represented as a vector. In fact, he gave this to explain his concept of vital force or vision by another name, the autocracy. And let us now talk about autocracy. For better understanding what Hahnemann means, let's understand what he means by autocracy by understanding what we mean by democracy. Now, what is India? India is a democratic nation. And what is democracy? Democracy is a concept which governs our Indian nation. Can you see democracy? We live in a democratic nation, but we can't see democracy. We feel democracy, but we know that democracy has four main pillars: the parliament, the judiciary, the law enforcement agencies, and the fourth pillar, the press. Now, similarly, let us see that the Hahnemann's concept of vital force has four main attributes: the formative force, the destructive forces, the immune forces, and the balancing forces. They are in our body, there are only four forces. Like the four pillars of democracy, autocracy is based on four forces, and all these forces have their own systems. Now, you can't see the force, you can't see those energies, but you can see those systems and you can see the edifice of those systems. Now, balancing energy, the balancing force, they have three main systems: the autonomic system, the hormonal system, the autoregulatory mechanism. Now, you study them under anatomy and physiology. Then the creating energy, the creative force. There are three systems: the reproductive system, the repair mechanism, and all the anabolic processes of the body. You study them under biochemistry, anatomy, and physiology. Then destructive energy or destructive forces. You have apoptotic mechanism, that means cell death, and catabolic processes. You again study them in biochemistry, anatomy, and physiology. And finally, the policeman, resisting energy, law enforcement energy, law enforcement forces, the immune system, immunity. So you see, this is what is autocracy, the concept of vital force. So you can't see democracy but see its effects on our nation and see its functioning through its attributes or symbols. Similarly, autocracy cannot be seen. The vital principle, vital force, dynamis, or vision can't be seen. Its functioning in health and deviation from health as morbid signs and symptoms, which is called disease, is felt and perceived. Now we come to understand what Hahnemann means when he says that vital force or autocracy is the conceptual controlling principle of life. And I think from now onwards, there can't be any debate about it. Then coming forward, Hahnemann's concept of disease is also very clear cut. In the bracket, you have the references in the organelle. Now, Hahnemann classified diseases in three ways: the therapeutic classification of disease, the causative classification of disease, and the clinical classification of disease. Now see, Hahnemann classified diseases therapeutically as indisposition. Indisposition is simple variation from health which is going to pass on by itself. Dynamic disease, which means these are pathophysiological diseases. These are medical diseases. And then surgical diseases. For medical diseases, he says, for a short-term disease, antipathy might work, but in the long run, you need homeopathy. For surgical diseases, he says, you need surgery. Dynamic diseases, he says, which means the pathophysiological diseases, he says, are of three types. The acute. Acute can be rapidly deteriorating acutes, which require emergency measures. In today's scenario, they require ICUs. Intermittent and chronic. The intermittent can be two types: at fixed interval or at variable intervals. Chronic diseases, he says, and we are going to discuss that chronic diseases can be because of medicines. They can be false chronic disease because of living in faulty conditions, because of other things. But the true chronic diseases are chronic miasmatic diseases. Now, diseases are nothing other than alteration of conditions in healthy people which express themselves through disease signs. Hahnemann describes very aptly that diseases are dynamic mistunement of vital force. You can compare it to your radio station. Your radio station is tuned at 95.3. If it becomes 95.6, you would see that but the voice cracks. That is a morbid sign and symptom. So it is a dynamic mistunement of vital force. Then in footnote of 31 again, in footnote, he gives you the real thing. He says, when I call disease a derangement of man's state of health, I am far from wishing thereby to give a hyper-physical explanation of the internal nature of disease generally, or of any case of disease in particular. It is only intended by this expression to intimate what it can be proved, that disease are not and cannot be. They are not mechanical or chemical alteration of the material substance of the body and are not dependent on a material morphic substance, but they are merely spirit-like dynamic derangement of life. So for Hahnemann, diseases do not originate on the chemical or physical sphere except for surgical diseases or injuries, etc. Or for acute miasma, which he says can be because of, say, like measles or scarlet fever, etc., or in today's scenario, the viral diseases. But chronic diseases, they are dependent upon dynamic mistunement, which means some derangement either in the vital force or in the mind. They can be psychosomatic or somatopsychic. How true is Hahnemann? Now medicine is following his path when there is a branch called as psychoneuroimmunology or neuroimmunobiology. They are following Hahnemann's trend of thought now, and they are not even halfway through where Hahnemann was and where homeopathy is. As fundamental cause of true chronic disease, he names three basic miasma. Now, there has always been a confusion: Sora, syphilis, and psychosis. In fact, a very avid follower, a very trusted follower of Kent, Margaret Tyler, she has written a book on concept of miasma on uh, microbiology or micropathology, defining Sora, psychosis, syphilis based on microbes, which is wrong. This is the wrong trend of thought. That is why in our study I have not taken Margaret Tyler as as a stream of natural thought of natural stream of Hahnemannian thought, because Hahnemann has always stressed that it is internal Sora, it is internal syphilis, and it is internal psychosis. You have to go through the organ to understand what he means by internal Sora, internal syphilis, and internal psychosis. You have to go through what Allen has written, and you must now clearly understand what is Soric theory of disease as expounded by Allen. Hahnemann says in aphorism 80 that Sora is the real fundamental cause and producer of all numerous, I may say innumerable form of diseases, which figure in systemic work of pathology as peculiar independent disease. And how true he is. There was no concept of immunity in his time. Immunity, the concept of immunity has come only in 1940, I suppose. And 200 years ago, he is telling you that these independent diseases, which Virchow has labeled as different diseases, are not independent diseases. They are based on only something wrong inside invisible vital force. And this is deranged immune system. Just because science was not advanced, he could not name that thing, but he could feel that thing. That is the power of his reasoning, the reason gifted mind of the master. You must understand that. And miasma theory is right theory. The only problem is that the name is outdated. Now, Hahnemann's hypothesis was that chronic diseases are chronic because some unknown devitalizing principle subverts life forces in such a way that the dynamic mistunement of health cannot be corrected. I'll in further course of time will tell you how this happened, how immunity is so deranged that it cannot correct itself. He called these unknown devitalizing principle to be chronic miasma. In those times, miasma theory was in vogue. Miasma was defined as an emanation spreading in the air, exerting a morbid influence. So what he could have coined it? Air is something which is invisible. Vital force is something which is invisible. And now if there is something which is polluting the air, which means invisible vital force, he had to name it miasma. That is why he named it miasma. Not because he wanted to name it syphilis because of syphilis the microbe. It is a pollutant which is deviating the normal healthy vital force so that this happens. The true chronic disease, according to Hahnemann, are chronic miasmatic disease. Hahnemann classified chronic miasmatic diseases as two. Now you must understand what Hahnemann did while he was in Cottehen. Remember, in Cottehen for 16 years, he was thinking. And he was analyzing his own case histories. And what he did a very smart thing. He, in his histories, went to the root cause. What was the primary starting point of his chronic, of the patients who had chronic diseases? So what he found for him was surprising. He found that there were three starting points. One was all the patient either had sexually transmitted diseases or they had something else. So sexually transmitted diseases, he found there were two. They were the venereal diseases and the non-venereal diseases. The venereal diseases were two: the psychosis, which means gonorrhea, and syphilis. So psychosis, the Fegwort disease, which was typified by excrescences and gleat. Remember, he never says only warts or excrescences. He says excrescences and gleat. Similarly, with syphilis, he says the chancre disease, which is typified not only by ulcer but by also bubo. Then all the other diseases he dumped into one and called as the non-venereal diseases. Then when he started studying all his non-venereal diseases, he found that at some point of time, all the person who had non-venereal diseases had some kind of itch. So his mind started thinking, why did they have itch and what kind of itch they had? Now, to non-venereal chronic miasmatic diseases, he gave the name psora or the itch disease, which was typified not only by pruritus but a vesicular eruption or scaly eruptions, which he called as tetters. So psora is outwardly typified by three things as of Hahnemann. They are itch, it is pruritus or itch, small vesicular eruptions, not necessarily scabies. People confuse scabies with psora. It can be any vesicular eruption, and scaly eruptions. Hahnemann also states that the fundamental cause of all disease, including psychosis and syphilis, is psora. Now, actually, here Hahnemann is propagating his theory of causation of chronic miasmatic disease, which Allen refers to as the psoric theory of disease. And to understand miasma, you have to study H.C. Allen. Now, psora, now this is where we come to Allen. Now, psora is a potential that bonds itself with the life force. Now we are talking about, because Allen has come to this world, this medical world, wherein people are now talking about action potentials, because electricity has come. In Hahnemann's time, electricity was also not there. He was working under gaslight. But in Allen's time, people knew about action potentials. So we had potentiometer. So now Allen says that psora is a potential that bonds itself with the life force, which is our inbuilt vital potential, action potential. So you see, it is this psoric potential that pollutes or subverts the vital potential that causes mistunement in health, leading to diseases of innumerable names, which I think is the right thing. Now coming to our action potentials, like we said that cardiac axis is a vector. So we see that here is a vector of vital force, which is moving towards right, towards health. And when it is perverted with or bonded with the psoric potential, then it leads towards disease or death. By now we have also gathered that Hahnemann established psora as the cause of all illness, foundation of all sickness in aphorism 80. So we can safely assume that psora is nothing but altered vital force. Hence we can name mistuned vital force as psoric vital force. So this is what Allen meant by psoric theory of disease, that mistuned vital force should be named as psoric vital force. This is, remember, not Sora, the miasma. Under the influence of perverted vital life action, soric life force is no longer a true dynamis. It is in bond with another dynamis, Sora, which knows no law and has no life-giving qualities. It does not believe in homeostasis. It, in fact, has all the dealings of Sora which are destructive, which lead to pathologies or pathophysiology. Which means that in this table you can see that autocracy or normal vital force lead to healthy state, while mistuned vital force or soric vital force leads to deranged health or disease state, which reflect outwardly as symptom complex. The true internal nature of disease is thus made manifest in the study of the soric theory of disease. Pathology can do nothing more for us today than it did in Hahnemann's time, for the same reason that pathology is not at the bottom of the invisible process by which morbid changes and alteration take place in the organism. It is the same with miasmatic potential. It is an invisible and unseen thing, yet we see the effects of its presence in the organism long before any changes in tissue take place, provided you are proficient in it. We see it first as a rule manifest in the vital sphere, then in the physiological or functional sphere, then finally in the pathological, of course, coming last. Now you see in this chart that if the vital force is altered or if it becomes soric vital force, you can see symptom and signs everywhere in the body, provided you look for it. Now, the South American homeopaths, especially Pastero, Ortega, they named miasma as basic reactional mode, which is very true. They said that the body reacts under the influence of the soric vital force in different modes, and now we can understand because our computer has safe mode. You see, so computer also has different modes. Similarly, our body has different modes. All the past masters and we have masters, as we have talked about in the previous webinars, have described in detail the effect of miasma at different levels. I would like to tie together everything under three basic reactional modes as soric, psychotic and syphilitic reactional mode. You see, the perverted life force of soric life force that has psychotic reactional mode, wherein everything goes into excess. This is typified by metabolic syndrome. You can go and read metabolic syndrome. This is the psychotic reactional mode. The syphilitic reactional mode is where everything goes into negative. And then there is a soric reactional mode, which is an oscillatory reactional mode. In terms of immunity, we are going to go a bit further. Sora is an oscillatory or unstable reactional mode. Psychosis is a proliferative reactional mode. Syphilis is a destructive reactional mode. Now there are mixed miasma. Tubercular is a granulomatous reactional mode, and cancer is uncontrolled, proliferative and destructive reactional mode. We see the landmark of one of these chronic miasma stamped upon the organism. We see it in every feature and every physiological process, in the shape and contour of the body, upon the visual expression. We see it on the skin, by the response in the very inner being, the mental, the moral, even the spiritual. And we are going to talk about it in the end when I'm going to give you the key features with audio visual aids on recognizing the miasma, all the five miasma. Now, why must we know miasma? If we become acquainted with the character of Sora, whether acting upon the organism alone or in combination with some other miasma, we are more able to give a prognosis to the probable outcome in a given case of disease. The character and combination of the miasma give us the character of disease or disease formula. As we study these miasma, we see they express themselves in their degree of action and in their miasmatic nature. Now, the degree of action of miasma is primary, secondary, and tertiary. And the miasmatic nature is acute, chronic, or latent. As we study these miasma, we also see disease to be as an expression of three basic potential, the pathophysiological trends. He who has become acquainted with this higher homeopathics of Hahnemann, which comprises not only of disease potentials, but the drug action, can apply the law of similia at a deeper level. In fact, once you start working at this level, you enter the second ladder of homeopathy. The second, another door, when miasma open up to your mind, you enter into the second level of homeopathy. So now coming the core of immunity and homeopathy. Let us come back to science. And let us see how Hahnemann and miasma theory is so closely related to modern science. Since Hahnemann's time, pathophysiology has moved on, and now one thing is clear, that in the genesis of disease, immunity is the common denominator. It is clear now that chronic diseases as well as acute diseases are caused by disordered immunity. Now, this disordered immunity can be equated to the soric vital force. Even the mental diseases ruin health via immunity, as proven by psychoneuroimmunology. This has been established by PNI. We can explore miasma theory on the basis of immunity, and let's do it. Now, two scenarios. Altered immunity leading to hypersensitivity reaction, leading to immunodamage, genesis of chronic disease. Immunodeficiency state, external pathogens cause direct cellular damage, leading to chronic disease states. Please take note that soric reactional mode is, now we are not talking about soric vital force. We are talking about Sora, the miasma. That is soric reactional mode is an oscillatory reactional mode because it oscillates between exaggerated immunoresponse, that is hypersensitivity, and immunodeficiency states. By this logic, hypersensitivity reactions are fundamentally soric reactional modes. And this proves that Sora, Hahnemann's observation in para 80 that Sora is the fundamental cause of disease is correct. Now, what is the correlation between immunodamage and miasma? Now, immunodamage caused by hypersensitivity leads to a spectrum of disorders. There are 5 types of basic hypersensitivity. Remember, hypersensitivity reaction means exaggerated immune response. And I would draw similarity of 5 basic hypersensitivity reaction in the next table. Type 1 is IgE based hypersensitivity, which we call as anaphylaxis. It is normally expressed on the skin as wheal and flare reaction or urticaria or simple itch. And remember, Hahnemann told us that psora is typically itch. Then type 2 is complement mediated hypersensitivity, the so-called cytotoxic reaction, which leads to cell destruction. As we know, cell destruction leads to ulcer formation. Now this is syphilitic reactional mode, the syphilitic miasma. Type 3 hypersensitivity reaction, IgM, IgG mediated hypersensitivity. It is called as Arthus reaction, wherein there is thrombus formation. Thrombus formation is clogging, which means there is proliferation. This is psychotic reactional mode, typical of psychotic miasma. Type 4 hypersensitivity reaction, which means exaggerated immunoresponse type 4, T cell mediated hypersensitivity. This is CMI, cell mediated immunoresponse, delayed hypersensitivity. This leads to granuloma formation. This is tubercular miasma. Type 5 antigen anti-mediated hypersensitivity. This is called as simulatory type. This simulates, this is exaggeration of all the hypersensitivity reactions. This is the cancer or canceric response. This is the cancer miasma. So you see how beautifully exaggerated 5 types of exaggerated immunoresponse fit to the 5 type of miasma that we see. 3 basic and 2 combined. Now coming to the core of immune system, so that you understand it properly, it is going to help you to understand and prescribe the test for all the influenzas and especially for the current pandemic of COVID. Activation of specific immune response. Now there are 2 types of immune response, the non-specific and specific. Now speaking of COVID-19, SARS-CoV-19 virus, this was never in this world before. So suppose it enters into a human organism body. So there is no specific immune response against it. So the non-specific immune response is going to take care of it, till some specific immune response develops. So non-specific immune response is the skin, the cilia in the nose, the mucous membrane. They are all a part of non-specific immune system. Then phagocytosis. So these are non-specific. The mucus. So the barriers, all the barriers are non-specific immune responses. That is why sanitation is very important. So we are not much concerned about non-specific immune response. That is why when you say that some medicine is going to provide immunity to COVID, so it is partially true. No medicine can be, completely said as completely preventive to COVID-19. No medicine can be 100% completely preventive to COVID-19 because this is a new virus. Our body does not know how to fight specifically against it. But activation of a specific immune response, it has 4 systems: humoral immunity, CMI, but these are later responses. The immediate responses are phagocytosis and complement fixation, then humoral immunity, and then CMI. Now the first thing is the macrophage. Suppose COVID-19 enters the body, it is an antigen. The whole idea of immune system is that it differentiates between the self and the non-self. The non-self is the invading agent. In our today's study, it is COVID-19. So COVID-19 virus enters. Immediately the macrophage is going to come. It is going to process, it is going to eat this COVID-19 virus. It is going to process the antigen and it is going to present this process antigen to the B cell and the T cell. Now this specific antigen of COVID would attach to the B cell and the B cell is going to be converted into a lymphoblast. This lymphoblast is going to be converted into a plasmoblast. This plasmoblast is going to be converted into a plasma cell, and then this plasma cell is going to be converted into antibodies. Some part of this plasma cell is going to be a memory B cell. It is kind of a fingerprinting bank. Like you have a fingerprinting bank of criminals, this would go into the memory of a fingerprinting bank of COVID-19 criminal. You have a criminal record of all the viruses in your body. Now COVID-19, since it is a new criminal, it is going to enter your memory bank of plasma cells, memory B cells. But the antibodies against COVID are going to be now secreted in the body. IgG, IgA, IgM, IgD, IgE. Now IgM would be the first antibody. If there would be excessive overload and if there would be a first response, allergic response to exaggerated anaphylactic response to COVID-19, it would be because of IgE. But if IgE would not be plenty, then IgM would be the first and the later antibody would be IgG. Now this antigen antibody fixation is going to cause an immediate reaction leading to further phagocytosis and complement fixation. Now this complement fixation is going to lead to a cascade of reactions, release of cytokines, and these cytokines are going to lead to inflammation all through the body, which may lead to several pathophysiological phenomena which are going to be presented to you as inflammation, dry cough, etc., etc. And they may lead to lung damage. They can also lead to, if you have comorbidity, then it can lead to DIC, and they can lead to many things. A host of phenomena which we are going to talk on later when we are going to talk about SARS-CoV virus later on. Now, activation of CMI. Now, when this macrophage, which has swallowed, engulfed the COVID-19 and processed it and presented the specific antigen to B cell, it also is processed the antigen and presented it to the T cell. Now, this T cell, it transformed itself and it is called as transformed T cell. Now, this transformed T cells, they secrete lymphokines. Now, one of the important lymphokines that you are going to test is going to be interleukin, especially interleukin 6. There are other also. Then transformed T cells are basically going to be transformed into cytotoxic T cells, which is called as K cells, which are killer cells. These are codenamed CD8+. They cause cell lysis and programmed PCDs, programmed cell death or apoptosis. They are also going to be transformed into T helper cells, which is codenamed CD4+. They promote B cell activity. They are going to amplify B cell response. They are going to lead to more of complement fixation, more of memory cell formation, and more of complement fixation is going to lead to more of cytokines, more of inflammation, etc. And then some transformed cells are going to be, transformed into T suppressor cells. They are going to help in the long run to suppress inflammation. So there are two things going on: promotion of inflammation and, in the long run, suppression of inflammation. It is like seesaw. Now, when I say it is like seesaw, therein comes the concept of immunological balance. The immunologic system may be viewed as a system of cells and cell products whose main function is recognition and destruction of foreign material. In this study, COVID-19, the efficacy of this removal will determine the net result. You see, this seesaw, ये जो खेल है between T suppressor and T helper, killer cells and helper cells, killer cells and helper cells, suppressor cells, killer cells, helper cells, killer cells एक scale पे, suppressor cells एक scale पे. Which is going to win? What is going to balance? If without any damage, the patient gets out of COVID-19, then it is a beneficial immunological response. It is called as immunity. But if the patient falls sick, then it is called as hypersensitivity. It is mistuned immune system. This mistuned immune system is because of soric vital force. And soric vital force has been mistuned because of several factors, as Hahnemann has told us. One of them being our bodily constitution, which means comorbidities, our genetic predisposition, our structure, our mode of living, our moral, spiritual, and our diet, etc., etc. So this is all which correlates beautifully to our Hahnemannian thought and Hahnemannian reasoning. Let us now construct a working hypothesis of interaction of various components between environment, target cells, phagocytic mediator, and SAR cells. Now, target cells in COVID-19 are plenty, but basically it is the respiratory system, because every case which is admitted in the hospital has pneumonia. We are going to talk about it. Target cells are heart, the cardiac cells. They are the arteries. Let us see how this immunological balance is important to us. Following confrontation with an antigen like COVID-19, there is a disequilibrium in the host. There is a disequilibrium. Immunologic balance is then restored by an appropriate set of immunologic responses involving this multipotential system. Total immunologic response of the host can be divided as primary, secondary, tertiary. And remember what Allen has said, what Hahnemann has said, that miasma has primary, secondary, and tertiary stages. Herein, miasma theory has been proved in its evolution by the immune system. The primary response, non-specific response. In SORA, it is seen as itch on the skin. Secondary response, the specific response, in case of SORA, would be a wheel flare reaction or flakes or tetters. In case of syphilis, would be an ulcer because there would be a syphilitic reaction mode. Cytotoxic reaction है ना. In Arthur's reaction, what it would be? It would be a proliferative reaction, some kind of proliferation, some kind of condylomata, and tertiary would be internal damage, tissue injuring response. How beautiful observation was of these great masters like Allen, Kent, Roberts, and of course Master Ehrman. Beautiful. Now you see the concept of elimination and suppression as proved by immunology. The basic idea of immune system or immunity is to eliminate. So in the primary stage, when there is only an inflammatory response after phagocytosis, the processed antigen, if it eliminates, and skin is an eliminatory organ, as is the lung, as is the urinary system, as is the digestive system. Diarrhea is also elimination. Increase in bicturation is also an elimination. Phlegm is also an elimination. Sweating is also an elimination. And of course, rash is also an elimination, as you see in measles. If there is a successful elimination and you do not suppress it, then the disease goes away. But if this successful elimination is either suppressed or it does not take place properly, then there is an antigen persistence. Now this antigen persistence means that there is no elimination and the secondary specific immune response has to be initiated. Now this secondary immune response is humoral and cell-mediated immunity. Now you know when humoral immunity is initiated, IgE, complement-mediated, IgG, IgM, IgG response occurs, and when cell-mediated immunity occurs, then secondary response occurs. Now at this stage, if there is successful elimination, what you see is that the disease doesn't cause deep internal damage. There is slight damage like ulceration, etc., but there is no deep internal damage. There is only functional pathophysiological damage. But even if at this point no elimination happens, now what happens? The tertiary response is initiated. This leads to chronic diseases, immunologically mediated diseases of man, which are called as type 1, type 2, type 3, type 4, type 5 hypersensitivity reaction. Even if at this time elimination can take place, there is some chance for the person to survive. And if there is no elimination at this time, then there is no chance. This becomes a lifelong disease, which is a chronic miasmatic disease. Now you can understand what Herring says, that the disease is eliminated, and it is eliminated from within to without, from mental plane to the skin, and from the most important to the least important. So this is what the concept of elimination is, and this is how the concept of elimination of homeopathy is related to in immunity and psychoneuroimmunology. Again, coming back to type 1, type 2, type 3, type 4, type 5 hypersensitivity reaction, tertiary reaction lead, that is the chronic miasmatic diseases. Type 1 reaction leads to anaphylaxis, atopy and allergy. This is IgE mediated. This is our psoric reactional mode. Type 2 is cytotoxic reaction. This is complement mediated. This is lytic cell destruction, which means this is syphilitic reactional mode or syphilitic miasma. Type 3 is Arthus reaction, which is complement mediated and platelet aggregate. This is psychotic thrombus formation. This is psychotic miasma. Type 4 is CMI, delayed hypersensitivity. This is T cell mediated. This is tubercular granuloma formation. This is tubercular miasma. Type 5 is stimulatory type. This is antigen antibody stimulate. This is canceric type. Now, at this point, since we are now going to shift from immune system to COVID, I have been talking a lot about theory. I have yet not presented to you of what I have been doing with, in my clinic. And I've been doing plenty of things. Now, in this COVID pandemic, we have done many things. I have till now treated 132 cases on record of COVID, and with 100% success rate. None of my patients have been admitted to hospital. None of my patients have been gone to ICU. None of my patients have been put on ventilator. This was the most serious case that I handled. And this shows us the power of homeopathy over COVID-19. Now, this is a case of 81-year-old male who presented with fever to an allopath who advised him to immediately be admitted. I'll tell you why. He did not go in for COVID. The allopath did not go in for COVID test because he said that you would be hospitalized first, then you would be tested for COVID, and then you would be treated. He had his own reasons, which were right. His son came to me. I said I would only take I only take COVID cases by telemedicine, and I don't see them face to face. I see them by video conferencing. I have a method which I'm going to teach you today. Now, this case, we got a rapid antigen test done, which came out to be strongly positive. Now, comorbid diseases were type 2 diabetes mellitus for many years, hypertension, dyslipidemia, cystitis for which he was being currently treated, recent surgery for transitional cell carcinoma, urinary bladder. So this was a bad case. And his son knew that this case, if he went to hospital, especially to a COVID hospital, he is not going to come back. His son is a practical man, father is also very practical, and they are a lover of homeopathy. They said, either my father dies or he gets all right with homeopathy. We trust you completely. You please take the case. I said, give me in writing. I'll take the case. They gave us in writing and I initiated the treatment. Now, on the 3rd of September, he came positive, as you see. On the 7th of September, which means after 4 days, he became negative. So now at this point, after 130 plus cases, I know that if your homeopathic medicine is right, a patient gets negative in 3 days. That is the power of homeopathy if you do it right. Howsoever serious the patient is. Now he went to the allopath on the 25th of August. He did his interleukin 6 test done. He had fever on the 25th. His interleukin 6 was 20. The normal is 7. So it was about 3 times more. That is why the allopath said that, look sir, you are having an inflammatory response which probably is in your lung and you must now get admitted. We will do your CT scan, etc., etc. You are COVID positive. You seem to be COVID positive symptomology because you are coughing also, you have fever also, and then we are going to treat you. And probably you are going to be put on BiPAP or oxygen and be given your remedies. He said no. Then on the 3rd, when he came to me, we got him tested. His COVID status was positive. At the same time, on the 3rd, we got him tested for IL-6. On the 4th, his IL-6 report came to be as more than 5,000. So from 20, it was more than 5,000. Now this is called as cytokine storm. Now this guy was having cytokine storm. The cytokines that were being released from his complement system and from his T cells were way ahead, and this is a medical emergency. I said to his son, prepare for BiPAP at home, prepare for oxygen at home. It might be needed anytime. At this point, we were monitoring his SpO2 and his SpO2 went down to 84. Less than 92, you require hospital admission, but since they were adamant, either he dies at home, we don't take him to the hospital. I increased the doses. I was not doing classical homeopathy. I was doing layered homeopathy as advised by Burnett. And my prescribing style was as advised by Borland. And the result was that on the 7th, his COVID status was negative. And on the 17th, his IL-6 was normal, 7.69, which means about 13 days later, his COVID storm has completely passed away. And he was normally still normal. He now goes to his office also. So this is the power of homeopathy. Nobody recognizes us, not even the government. But we can do wonders if they ask us to do. And these are the reports. So I am documenting my cases. I would ask you to document your cases also. How to do it? I'm going to tell you now. Now I'll tell you about the medicines. From second onwards, I was giving him Brineia and Trustox in 10 potencies, repeating frequently, repeating alternatively. They were not mixed single medicine at a single time, but repeated frequently. But once he entered into cytokine storm, even I was very afraid. I don't want my patient to die. So I switched over to Brineia and AVRA and gave him Senega 3x to tone up the lung, Cobricio 3x to tone up the vagus nerve, and Lovelia 3x to tone up the vital force and lung and the respiratory system. And this is how we saved him. I am very honest with what I do, and in all my seminars, I would always tell you the truth of my prescribing. That you can be sure of. Now, a word about cytokine storm. Now, this word was coined in 1993 for graft rejection. This became fashionable during 2005 avian H5N1 influenza, the bird flu. Incidentally, in bird flu, homeopathy was very effective. Medicine by the name of oxylococcinum by Boyron was very effective in bird flu, avian H5N1 influenza. Excessive uncontrolled release of pro-inflammatory markers is a hallmark of cytokine storm. Inflammatory response, it flames out. Now again, if you study Hahnemann and Organon, you would see Hahnemann tells you it is the acute flare-up of psora. And Hahnemann always tells you how to manage it. Never manage it with a constitutional remedy. He tells you that manage it with Asorix. Acute flare-up of psora is to be managed by Asorix like Brineia, Belladonna, Hyoscyamus, Opium, etc. He names them. Aconite. So Ignatia, he names them. Acute flare-up of psora is to be managed by Asorix. And once the storm passes, he uses the word, once the storm passes, then is the time to use the so-called constitutional medicine. Constitutional medicine, as per Hahnemann and Kent, is a totality-based medicine, so that the patient settles down and his constitution is so much toned up so that he does not have a second bout. Now, cytokine storm is also known as medically CRS, cytokine release storm. CRS leads to acute lung injury. It is called as ALI. Now, ALI leads to SARI, severe acute respiratory injury. ARDS, acute respiratory disease syndrome, leading to death or leading to recovery. Mostly in COVID cases, it leads to death. But in this case, thankfully, thanks to homeopathy, it led to recovery. Now, CRS is more common in viral infection, especially in SARS-CoV-2, also in MERS. It is common in immune-related diseases. It is common in immune system-related therapy like CART and organ transplant sepsis, where organ rejection happens. Now, what happens in CRS is that virus activates innate and adaptive immune system, leading to inflammation, leading to increased vascular permeability, leading to severe acute respiratory infections, leading to acute respiratory distress syndrome, leading to pneumonia, consolidation, death or recovery. Mind here, homeopathically, pneumonia is very important. And in the next turn, we are going to talk about pneumonia. I have left out the understanding of miasma, postponed it for later date, because right now understanding pneumonia and management of pneumonia is very important for you in the current scenario. So next session would be about managing COVID pneumonia and understanding Borland's way of prescribing in pneumonia. And I promise you, if you do it, you are not going to lose your patients. You are going to gain in your practice. And I'll tell you the best way to do it. So this is about immunity and a case that I presented to you. Next, we are going to talk about the next slide would be about the next presentation would be about the 2019 nCoV virus. Now, as you know, coronaviruses are RNA viruses. Although most human coronavirus infections are mild, remember in India it is even more mild. The epidemics of the two beta coronaviruses have higher mortality than SARS 2019 nCoV. But SARS-CoV virus had 10% mortality. MERS-CoV virus has 35% mortality. What we saw in December 2019 was a series of pneumonia cases of unknown cause emerging in Wuhan. Sequencing analysis from lower respiratory tract sample indicated a novel coronavirus. This was named 2019 novel coronavirus, the 2019 nCoV. Findings by January 2020, there was 41 admitted hospital patient had been identified as having laboratory confirmed 2019 nCoV infection. Now, common symptoms at the onset of illness were fever in 98% cases, cough in 76% of cases, myalgia and fatigue in 44% of cases. So these fever, dry cough, myalgia and fatigue are the core symptoms. Less common symptoms were sputum, 28%, headache, 8%, hemoptysis, 5%, diarrhea, 3%, and these are less common symptoms. As this COVID infection moved on from Wuhan to Iran to US to Europe to US and India, we have seen a particular key symptom emerging, and that is an anosmia and ageusia, which means loss of smell and loss of taste. It was also seen that dyspnea developed in 55% of cases and lymphopenia in 63% of cases. Now, this is very important. Lymphopenia. Most of the viral cases have lymphocytosis. Now, strikingly, in 63% of cases, you find lymphopenia. So, in any case of fever that comes to you today, it is mandatory to go in for CBC and ESR. So if in CBC you see that there is no neutrophilia, which means neutrophils are normal, there is no increase in TLC, and you see lymphocytes are less, then you must suspect that this is a case of COVID, because COVID has lymphopenia. And it was also seen that all the patients who were admitted in the hospital by January 2, 2020, they all had pneumonia and abnormal findings on chest CT. And this abnormal finding is called as ground glass opacity, GGO, ground glass opacity. The characteristic of this GGO is that it is on the periphery rather than the central, and there is crazy pavement pattern. Now, these are the two hallmarks of the pneumonia that develops in that is seen in the chest CT. So you must remember that. Now, complications of COVID include acute respiratory distress syndrome in 29%, anemia in 19%, acute cardiac injury, which may appear as MI, or ventricular tachycardia in 12% cases, secondary infections which may lead to septicemia in 10% cases, and ICU admission in 33% of cases. Patient with severe illness developed ARDS and required ICU admission and oxygen therapy. The time between hospital admission and ARDS is sometimes as low as 2 days. The rapidity of infection is something which is very, very important in COVID-19 in patients who have comorbidities. Remember, children and young adults are not going to be affected much by COVID. Even if they have COVID, they are not going to be affected much by COVID. It is people with age of more than 50 and having comorbidities which are going to be affected more. Now the mortality rate is 15%, but in India the mortality rate is going to come around 1% only. In the end, you would see that India would have a very less mortality rate because of certain good actions taken by this government. So the mortality rate is not going to be much. So the number of deaths have risen quickly. People are now in India, they are becoming careless, and I'm afraid with the festive season coming on, COVID is going to have a second peak, and we have to be ready as homeopaths. We have to be ready for this second peak because people are going to come to us. People have seen that government hospitals are, due to so many reasons, people are not wanting to go to government hospitals. Private hospitals, many can't afford. We fit in somewhere in between, and we are having good, efficacy, and our rate of cure is better than other people. Although the government is not ready to accept that, but we can at least be ready, and we can collect the data and present the data to the world. And Indian homeopaths are in a better position to do so because people trust us. Nobody else can trust us, but people trust us. So let us now quickly come forward to what to do. Now you are to first test on the likelihood of COVID-19 in your patient. So you have to screen your patients for COVID probability. Now this screening has to be done in two parts. Initial screening, and then there is a screening criteria and score which is given to us by the Ministry of Health. Now in the modern clinical setting, nobody wants to see a COVID patient directly. And with the advent of telemedicine, this has become very easy now, especially for us homeopaths, because we are more dependent upon the phenomena and the morbid signs and symptoms. So we can assess our patients through telemedicine. So the general assessment of initial screening is assessment via telemedicine. Where possible, undertake initial assessment over the phone or by video consultation. This is preferred as it provides additional cues. This video consultation provides additional cues and therapeutic presence and may prevent the need of an in-person visit. and this is also recommended by British Medical Journal. Now, if you are to assess a person in your clinic, then your clinic must have a triage area. If a person symptoms is suggestive of COVID-19, then and he presents to you in the clinic without a prior tele-assessment, undertake the initial screening outside the clinic or in a triage area away from other people. Now, the symptoms and signs, you ask for the following: date of onset of the symptoms, ask for the core symptoms of fever, shortness of breath, dry cough, muscle aches and tiredness. Then ask for other symptoms of sore throat, headaches, runny nose, diarrhea and nausea. Then ask for key symptom of loss of smell and loss of taste. Now, there is a beautiful screening criteria and score system given by the Ministry of Health of India. Now, there are 10 symptoms and there are concurrent points. Symptom number 1, cough, point given to it are 2. Symptom number 2 is diarrhea, point given is 1. The score given is 1. Symptom number 3 is sore throat, score given is 1. Symptom number 4 is body pain or lethargy, score given is 2. Temperature more than 100 degree Fahrenheit, score is 1. Difficulty in breathing, score is 2. Travel history during last 14 days, score is 3. Direct contact or taking care of a COVID-19 patient, score is 3. Contact with any person who has recently come from area of COVID-19 patient, score is 2. Any person who has attended any conference, meeting, marriage, puja or namaz, the score is 2. And when you add up, if the score result is more than 5, then you suspect this case as a COVID positive case, and this case requires further evaluation and management by you or by a consultant. Now, this person who has a score more than 5 requires consultation and management in the following steps. You must have a proper way of analyzing the history. So you have a proper case sheet which is format based. Now, this format has been developed by us in our art homeopathy study group. Now, this is a format based history taking. Day of onset of symptoms, you must note down when the patient had the onset of symptom, what day 1 should be the day of presentation to you. Then when you have scored him, take him as a COVID probable. And when you ask about fever, obviously the patient is going to come to you only when he has fever. He is not going to come to you when he is asymptomatic. So ask whether he has fever with chill, or ask whether he has fever without chill. So divide your patient in fever with chill or fever without chill. Now you see, fever with chill, you have certain repertory rubrics. Fever without chill, you have, which means fever with heat, you have certain repertory rubrics. They are same in number. The first is fever, zymotic fever. Second is fever chill with. then chill in general, head pain, chill during, head heaviness, eyes heaviness, eye pain, eye inflammation, conjunctiva, throat inflammation, cough dry, cough loose. Now, if he is having cough dry, you take cough dry. If he is having cough loose, you take cough loose. Then nose coryza discharge with, nose coryza discharge without. If he is having nose coryza with discharge, you take point number 12. Nose obstruction, chest inflammation, lungs, respiration difficult, cough with, respiration rattling, mouth taste diminished, mouth taste wanting, loss of taste, nose smell diminished, nose smell wanting, extremities pain, chill during, extremities pain, leg fever with. Now this is very important. Extremities pain, leg fever with. What we have found in Kanpur is that many people are coming with this symptom, extremities, leg fever with, and nowhere else. This is very important. Why? Because Rust tox is given in first grade. So in such a patient where this symptom is coming, we are taking this symptom as striking, singular, uncommon and peculiar symptom. And what we are going to do is, we are going to eliminate our case with this symptom, and probably Rust tox comes to be the first remedy. So we use this as eliminating symptom, but this is again a choice of you, for you. Then mouth dryness, stomach thirstless, stomach thirst. So whatever the patient tells you, if he is thirsty, then you have stomach thirst. If he is thirstless, then you use stomach thirstless. Then stomach thirst, small quantities for, stomach thirst, large quantities for, rectum diarrhea, stool thin, rectum constipation, stool hard, sleepiness, chill during, sleeplessness, chill during, general weakness, fever, chill during. Then we have 4 or 5 empty rubrics. This is for individual symptoms that you find on the physical plane, or striking fundamental shift on the mental sphere, like if the patient is very panicky, or the patient becomes weepy since he has fallen sick, or the patient becomes very restless since he has fallen sick. Then you repertorize, and the first remedy that comes, first 5 remedies that come in your repertorization, you study them, you choose the remedy, and you prescribe that remedy in whatever potency you feel is good for you or you feel comfortable with. Prescribe that remedy, repeat it frequently depending upon the severity of the disease, and note down the results. Coming back to the previous slide, this is one way of taking the history and reaching to the drug. Then there are other clinical factors that you must see. Now, these other clinical factors are very important. You must examine your patient, undertake the in-person assessment or as per other clinical factors, and in addition, check temperature, pulse, respiratory rate and effort, degree of cough, presence of sore throat, assess SpO2, and if normal, consider repeating after gentle exercise. Now, of course, if you are examining your patient, you have to put complete PPE kit on and be safe. Otherwise, don't examine the patient. Let the patient be isolated in his place and let some of the attendant do the duties, not you. Your safety is the most important thing because you are going to serve many people. Potential risk factors for more severe illness, you must always remember: old age, 50 and above, history of smoking, comorbidities are very important. You must always note down in your history sheet whether the patient has any lung disease, including COPD, asthma, bronchiectasis, any cardiovascular diseases, including hypertension, whether he is in a immunocompromised state, example diabetes, chronic kidney or liver diseases, or taking chemotherapy or steroid or any other immunosuppressant. Any patient who is having diabetes is the most uh, risky patient, and diabetes and hypertension is very bad. You must keep a close watch on such patients. You must also assess symptom severity, assess the degree of breathlessness by asking the person to describe their presenting problem in their own words, whilst assessing the ease and comfort of their speech. Sometimes the patient would not say that he is breathless, but the way he is speaking would tell you that he is breathless while talking. Respiration difficult, talking while is the rubric to add to your repertory. The impact of their symptom on their usual daily activities. Focus any change in breathing from normal, such as new audible wheezes. You can sometimes hear the rattling and wheeze. And always be aware of differential diagnosis. Serious differential diagnosis include bacterial pneumonia, meningitis, and sepsis, which you can do by investigations. Influenza is more likely to produce body aches, whilst COVID-19 is more likely to produce shortness of breath. This is something that you must remember. Now coming to lab testing. As soon as you suspect somebody of COVID-19, immediately go in for rapid antigen test. Rapid antigen test, within 15 to 20 minutes, you are going to get to know whether the patient has COVID, whether the patient is COVID positive or negative. Now, if the patient in rapid antigen test comes to be COVID positive, it means that he is confirmed COVID positive. But to be doubly sure, you sent the sample to another sample for RT-PCR. If the patient comes to be in rapid antigen test, he comes to be negative, it means that he can be COVID positive. You are not sure. So you definitely send the sample for RT-PCR. Because RT-PCR is supposed to be a gold standard, although what we have seen in practical setting is that RT-PCR is also 75% sensitive. Sometimes RT-PCR also comes out to be negative, but the patient is classically, symptomologically presenting as COVID. So in this case, go in for a HRCT thorax, and you would be surprised to see the classic COVID pneumonia changes in the thorax, in the lung. And for me, I suppose that CT thorax has come out to be the more sensitive investigation of choice for me for COVID than RT-PCR. Now, other investigations that are very important are CBC and ESR. ESR obviously would be raised. In CBC, you look for if there is increase in TLC, then you suspect for some kind of bacterial infection and or impending or evolving sepsis. If there is lymphopenia, you strongly suspect COVID-19. HbA1c, if it is increased, then you know that there is trouble of high glucose for past 3 months. This is a problematic case. You have to watch out for this case. If IL-6 is raised, you know that there is a problem. The inflammatory marker is raised. Inflammation is already set in the lung, and you have to be very cautious. If you are not confident, refer the case to the hospital. If CRP is raised, again, inflammation is going on. If LDH is raised, then also it is a marker of inflammation. D-dimer is raised, it is a marker of impending intravascular coagulopathy. This again is a grave sign. Refer the case to the ICU. If PCT is raised, then it means PCT is procalcitonin. It predicts that septicemia is impending. If you are not confident, send the patient to the ICU. So this leads to you knowing which is the mild, which is the moderate, and which is the severe case, so that you can take a decision whether to treat this case or not to treat this case. Now, definition of disease severity is very important to understand. Mild illnesses, adults, and we are talking about adults and not children. Adults not presenting any clinical feature suggestive of moderate or severe disease or a complicated course of illness. Characteristic of mild illness are that there are either no symptoms or mild upper respiratory tract symptoms, or cough, or recent myalgia or asthenia without any new shortness of breath or reduction in oxygen saturation. Patient says, I am not feeling well. मुझे थका थका लगता है और हरारत लगती है, which means low grade fever लगता है. So this is mild illness. Moderate illness, a stable adult patient presenting with respiratory and or systemic symptoms and signs with fever, but the patient is able to maintain oxygen saturation at about 92% or above, with up to 4 liter per minute oxygen via nasal prongs, and or without oxygen above 94%. Now, the characteristic of moderate illness is prostration, severe asthenia, fever more than 100 degree Fahrenheit, with persistent cough which may be dry, which is mostly dry, sometimes it is loose, clinical or radiological sign of lung involvement, no clinical or laboratory indication of clinical severity or respiratory impairment, which means IL-6 is not raised, which means PCT is not raised, which means D-dimer is not raised, but other values are deranged. Severe illness, adult patients meeting any of the following criteria: respiratory rate is more than 30 breaths per minute, oxygen saturation is less than 92 at rest state in normal patients and less than 90 in patients who are having comorbidities or especially lung diseases, wherein IL-6 is raised, wherein PCT, either PCT is raised or D-dimer is raised, where there is TLC which is raised, and there are signs of cyanosis, hypoxemia or shock. So in a case which you decide to take at hand, how do you follow up? You ask your patient to isolate at home. It should be a home isolation. You give a preventive, which in our case we are using phosphorus 12 as a preventive. We ask all the family members to take phosphorus 12. We give the indicated medicine to the patient to take it every 1 hourly. We use it in, if we want to give a low potency, we give 1 m. If we want to give a medium potency, we give 10 m. If we want to give a high potency, we give cm. We repeat it in depending upon severity, mild, moderate, severe. For mild, 4 hourly, for moderate, 2 hourly, for severe, 1 hourly. Daily monitoring, which is to be done by the attendant, is SpO2 4 hourly, pulse rate 4 hourly, temperature 4 hourly. And the follow up by doctor is to be taken on his history sheet day 1, day 3. Day 3 is very important because day 3 you must also get a IL-6 done and PCT and D-dimer done with CRP and LDH. Then day 5 is very important, day 7 and day 40 to see whether the case is improving or whether the case is deteriorating. In fact, in day 3, if you see the case not responding or deteriorating, you must always go in for a chest X-ray or a HRCT of the thorax, which means seeing the state of the lung and presence of ground glass opacities in the lung. So this is all that I wanted to tell you about the history taking and the thought process and workup on the case of COVID-19. Next time, we would talk about the management of all the three, the mild, moderate, and severe pneumonia, severe COVID-19 through homeopathy. What are the pitfalls? What and how and what are the limits wherein we should go. I would also present to you what we have done in our clinic, and very importantly, I would present to you Borland's pneumonia in a new way. Bedside prescribing by Borland was done. Borland was a master in pneumonia, and nobody has worked on pneumonia as well as Borland. My father always used to say that study Borland for pneumonia, but sadly, once antibiotics came, the role of homeopathy was relegated to history in pneumonia because most of the pneumonias were bacterial and bacteria were cured by antibiotics. Now, with overuse of antibiotics and with the immunodeficiency states and with these harmful viruses coming now, the need of homeopathy has come back again because viruses can't be treated by allopathy. And pneumonias, now you see Borland's prescribing would be required. And Borland, if you study, I would urge you to study Borland's pneumonia before attending my next webinar so that you would understand where I'm coming from and what I've done with Borland and how I have updated Borland for you so that you become a rapid prescriber. You see the patient, you ask 4 or 5 leading questions and you know how to prescribe. Forget about everything. You have 4, 5, 6 remedies in your mind and you rapidly, just ask leading questions. See if the patient cannot speak. You just see the patient, touch the patient, see the appearance on the face and see the skin, see how the patient is sitting and you prescribe. Borland has made it easy and it's a small booklet. It has been published by Vijan. And it's beautiful and it's amazing, and you would also lose the fear of prescribing high potency, and you will see the beauty of prescription and repetition of high potencies and how they work. My students have been working with the high potencies, and since they have been working with high potencies in acute diseases, they have never looked back into low potencies. Although I have been using low potencies now in chronic diseases with wonderful results. So, I mean, the game of potencies is like Game of Thrones. Yeah.
Yes, sir.
So, any questions? I'm there.
Thank you so much, sir. Looking forward to your next session. I guess everyone is looking forward for it. And today we learned a lot from you. You have really cleared all our doubts and confusions about COVID-19 today. Thank you so much for that. And dear learners, this is the time. Please comment in the chat box with your questions. Dr. Harshnikam will solve all your queries today. Please start typing with your questions, and we'll start the question and answer session in a minute. And also to tell them, you can enroll in Dr. Harshnikam's course on Modus Prescriber and Modus Foundation on the homeopathicacademy.com, where you can learn the concepts of organon in a new light, in a modern light. And as you can see, Dr. Harshnikam has explained everything in such a beautiful manner. So quickly tell us your questions for today. Okay, let's see if we have some earlier questions. So we can take them up first. So a learner wants to know, in chronic cases, can we start treatment with a soric remedy?
It's your choice actually. Hanuman has given you a choice. You can, like, I'll tell you, yesterday a case came to me. This is a lady living in Delhi. She has been treated by a very renowned homeopath in Delhi. I would not name the homeopath, but he's a Padma Shri awardee, and I respect him as a wonderful homeopath. And he took the case. The case was simple. It is a non-healing ulcer on the nose. I can present it to you the next time. Non-healing ulcer on the nose and on the wing of the nose. It initiated about 2 years ago with ulcer on the left side of the throat, then abscess ulcer on the mouth, and then ulcer on the skin. She was treated and is being treated by allopathy, etc. She gave her history to the homeopath, and he's a classical homeopath. He prescribed lachesis, which I suppose is the right remedy, and nothing happened. She was not cured by constitutional medicine. Then he added certain other small remedies, some pretty fantastic low potency remedies. Nothing happened. Then he prescribed kind of layered prescribing. I know the way he was working because I saw the whole prescription. It was layered prescribing, nothing happened. So the case came to me, somebody referred it to me. His husband is a doctor in AIMS. Her husband is a doctor in AIMS. So it came to me. Now I took the history on the phone. Then I had a video consultation. I talked to the lady. Now I have yet not prescribed. But once I took the history, I saw the medicines prescribed. Now what should I do? She has been prescribed by a better homeopath than me. But I know my miasma. She has ulcers. The miasma is syphilitic. I repertorized the case. There were many remedies. The first remedy was coming was lachesis. The second that was coming was sulfur. The third that was coming was nitric acid. And fifth was, I suppose, murk. And seventh, eighth was aurum, etc., etc. Alumina also was coming. Then there was one medicine which was in 8th or 9th number was syphilinum. Right? So my plan is that I'm not going to give him classical constitutional remedy, etc. And she was never given syphilinum or surprisingly any anti-syphilitic remedy. Okay. So my plan of action would be, I would be first giving her syphilinum in 3 divided doses as I usually do in 10 ml. And wait and see what happens. And incidentally, when I took first my junior took a history, when I took a deeper history, I came to know that she had 2 flary ulcer-like eruptions on her labia majora which were extremely painful. And I somehow have this art of talking to people and extracting information out of them in the first go. So I asked her very delicately that did you ever have any kind of immoral sexual contact? She said no. She was an outgoing, lovely. She's a Supreme Court lawyer. So she's outgoing, lovely, vivacious kind of a woman. She said no, I don't have. Maybe her husband has. Who knows? But they were, she said they are not like abscess. They were extremely painful. They were chancres. So what do? I give her syphilinum and see if the chancres come back. If they come back, I don't do anything. Keep her on placebo. And let's see the non-healing ulcers. I have promised her that her nose pin area, which has been now destroyed by the ulcer, is going to be all right. And she would wear a nose pin, and then I'll come and meet her. And this will happen. This is miasmatic prescribed. So you go with the flow. As the symptoms come, you are not to be prejudiced. This is what Hahnemann says. Never be prejudiced. Which is the topmost layer? You prescribe on that topmost layer.
That's very interesting. Okay, so let's take another question. Okay, a learner wants to know, does WHO recognition of homeopathy can make a difference as per pandemic is concerned?
It can, but WHO is not going to recognize. It's a political game, and homeopathy has always suffered politically because homeopathy is one alternative which is going to hurt big pharma worldwide. So if homeopathy is recognized, then it is going to, big pharma is the biggest mafia of the world, and big pharma is not going to let homeopathy survive if they have a free hand, and if we don't give result to the people, and the people don't believe us, then big pharma is going to eat homeopathy and destroy it completely. They have already, in the West, they have already said that homeopathy is witchcraft. Lancet has already written that homeopathy is witchcraft. It is all driven by big pharma and big money. So homeopathy, I see Indian subcontinent is the only place where homeopathy is going to survive, not because of classical homeopathy, mind you, because of homeopaths in India who have found the jugaad of, competing with allopathy and serving people as fast as homeopathy works. So it is with jugaad that we work. We have found ways of, non-classical homeopathy, which works very, very fast, and it is effective, and it is less expensive. So that's why homeopathy is surviving here.
Yeah. Another learner wants to know, sir, can we establish genus epidemicus in COVID-19 treatment?
It would be too early to say because every place COVID-19 is presenting with different symptoms, and every place can have a genus epidemicus. Like in your area, genus epidemicus can be different. In my area, it can be different because there are as of now, there are about 6 strains of COVID-19, and it is evolving. So in your area, genus epidemicus might be different. In my area, it can be different. So there can be no single genus epidemicus. My trend says that Brainia rustox are two important medicines that are coming out to be most common remedies. And in fact, what I've done is while I was prescribing for different patients, I've been prescribing in several ways. I've been prescribing in classical ways. I've been prescribing in layered prescribing. I've been prescribing as Hahnemann prescribed Brainia and rustox in alteration for typhoid epidemic in his time. but he used mother tinctures. I have used high potencies, Brimia, and in fact, what I found is that Brimia and Rustox in alteration has worked better than single medicine, and layer prescribing has worked best in very complicated cases, severe cases, and Lovelia as 3x potency. In 3x potency is very good for toning up all these respiratory symptoms of COVID cases. And you'll be surprised that Lobelia has been indicated by Borland for bronchopneumonia.
Okay.
It is only Borland who has indicated Lobelia for bronchopneumonia. That is why I say Borland was a visionary and must have seen thousands of cases of pneumonia. His booklet is amazing. And the problem is only this, that their nomenclature has not been. Do you understand the difference between lobar pneumonia, bronchopneumonia, pleuropneumonia? You don't, because this is not being taught to us, because this is outdated terminology. When we are going to talk about pneumonia, I am going to update your knowledge about lobar pneumonia, pleuropneumonia, bronchopneumonia. So this is all now outdated.
Yeah.
So like COVID pneumonia is bronchopneumonia.
Hmm.
COVID is zymotic. How many of you know that there is a rubric called as zymotic diseases in our repertory? You don't
Hardly
know.
anybody know. I
You pick up your repertory today and see a rubric by the name of zymotic diseases. Then you go to Wikipedia and see what zymotic diseases means. Then you would understand that COVID-19 is actually zymotic disease.
okay.
So if you want to select a remedy for COVID-19, it should fall into those remedies which is given in zymotic disease. That is why in my repertory sheet, I have taken zymotic disease.
Hmm. Okay.
It is zymotic fever actually. You go to zymotic fever and you will find, and Wikipedia, you go to zymotic disease and then you would understand what is zymotic disease.
Hmm. Thank you, sir. So let's take up a last question. I think we're running a little out of time and we have too many questions to take. Maybe Dr. Harshnigam can take more questions, more of these questions in the next session. So let's take a last question. A learner has three questions from you actually. She wants to know, is the man, acha, okay. Okay, she wants to know if COVID-19 is a man-made virus or is it a natural virus made by nature? She really wants to know.
How does it matter to us? It seems to be a man-made virus, yes,
Hmm.
because it is behaving unnaturally. Because no virus can, lie on the surface for 10 hours and survive. So
Hmm.
no virus is that tough. It seems to be a man-made virus. Its behavior is very rapid. So and everybody loves to believe in a conspiracy theory. I also love to believe in conspiracy theories. I believe that JFK was killed. So, I mean, conspiracy theories are lovely. So, and it seems to be a man-made virus, yes.
Hmm. Another question by the same learner is, is phosphorus or arsenic out? Which one to give as preventive, according to
It depends. If you take, take the grand symptomology of both the whole COVID phenomena, then you find two medicines to be simultaneously coming up, arsenic and phosphorus. But if you take pneumonia and respiratory symptoms predominantly, then phosphorus seems to be the more logical choice than arsenic album. So, I mean, the opinion for me is divided. I would favor phosphorus, and I have favored phosphorus since the beginning. I remember I was in Azamgarh, wherein I gave my first presentation on SARS COVID-19, which was before all this started. And therein I told people that phosphorus seems to be the medicine, and it was concurrently with this arsenic album being projected by. I'm not at loggerheads with Ayush, and they may be right, I may be right. We have been, there is a group that we have prepared. We are doing a multi-center study on phosphorus, and I must tell you that phosphorus for us has been preventive in the sense that, and I've always told the press also, that this is our phosphorus is not an immuno booster. It is not an immunity booster. Number one, it is not an immunity booster. It is kind of a preventive. It prevents infection, and infection might happen after phosphorus, but the patient would have a milder form of COVID. Patient would recover very fast, and sometimes would have no fever at all. And the trends that we are doing research in 5 cities, and the trend that we are having is that about preventive trend is about 65% of cases of people have been prevented with phosphorus. In some families where COVID happened, and we gave phosphorus. So most of the persons of the family were prevented, and they did not have COVID. So the trends are positive. But to say whether he is right or she is right, I can tell you about myself. I don't have data about arsenic album, but I can tell you for sure that camphor is the wrong remedy. That is for sure. Because camphor can only be indicated for people who are in ICU and who are in shock.
Okay, so another last question for today, I guess. How often and after how many days we should repeat the prophylactic, whichever one chooses? How often we should repeat it?
Um, if you can note down my WhatsApp number, and I have a kind of a booklet. It depends upon the quarantine, I mean, the level of quarantine, level of infection in your area. The repetition depends upon that. Red zone or green zone or whatever zone you are in, the repetition depends upon that. My WhatsApp number is 9918 80 80 80.
Okay, I'm sending it to all the learners.
9918 80 80 80. You can take it from us, so that's not an issue. And sharing information is not an issue. I would love all the young guns of homeopathy to come forward and take it ahead. I mean, I am more focused towards the young learners because I need them to grow and take homeopathy. Do not move to the spiritual side of the homeopathy or the mind side of homeopathy. Mind side is a part of homeopathy. Look at homeopathy from the totality. Be a good doctor first. You see, science is only going to recognize you if you are a doctor. If you talk about spirituality and religion and this and that, so homeopathy was wiped out of America because of Kent. So it is very sad to say this because they started talking about metaphysical ideas. They left, although Kent was not like that. Kent talked about the physical ideas, the pathological ideas. But his followers, they started talking about all the metaphysical ideas, and they stopped talking about the pathologies and the pathophysiology. So that was the reason why America lost homeopathy. We should not commit the same mistake. We should not go towards the metaphysical, spiritual aspect of homeopathy. There is an aspect of spiritual aspect of homeopathy, but the main, young generation must go towards the biochemistry, the pathophysiology, the clinical aspect of homeopathy, and prove to the world along with the evidence, and keep on collecting the data and prove to the world that homeopathy has its value. I believe that last 30 years working with homeopathy, I believe that homeopathy is clinically the best pathy for chronic miasmatic diseases.
Thank
There is no
you.
question.
Thank you so much, sir. We have actually learned a lot today, practically, clinically, in every aspect. I am sure everybody, accepts this. And I want to thank you so much. And I want to tell our dear learners that since we have Dr. Harshnikam's course with us on THA, so for the webinar attendees today and tomorrow, we have a special offer for you only for the attendees that we have in our session today. So you can avail a flat 40% off on Dr. Harshnikam's course on THA, and you can use the code LFH40, which I have sent you in the chat, and you can visit our website www.thehomeopathicacademy.com and avail the offer. It is valid only until tomorrow for you people. Also, I guess you can see a chat, a poll section on your chat, so you can, give us the review on our session today. All said. Okay. So I'm really sorry if I couldn't take up any more questions. We are a little running out of time. And
Send me on my WhatsApp. I'll answer you.
yes, you have his number and you know Dr. Hashnikam sir now, and he will answer all your questions, or you can take up the questions in the next session. Or anyway you like. All right, so let's finish up our session for today. Also, to inform our learners that we have another webinar coming up on 16th of October at 4 p.m. and it is on the art of cracking competitive exams and job interviews in homeopathy. And you can register for it. You will receive the link in your mail and in on our social media handles. But I'm also providing you the link in the chat right now, so you can register yourself. So thank you so much, sir, for such a great session. We really
Thank you,
loved it.
madam.
And would you like
Baba
to
guys.
say something to our learners?
Yeah, I would like to say that just rise up, shine, join my course, come to the modern world, the digital world of homeopathy. Let us march together and let us show the world what homeopathy is and the standardized version of homeopathy. And let's do it, and we'll do it. And all the best to you. Have a great day. Bye bye.
Thank you, sir. Thank you, everyone who joined us here today. Thank you so much. We'll take your leave and we'll meet in the next webinar. See you all. Bye bye.